Hello everyone, my name is Sundas Bibi and today I'm going to discuss professional practice. Inside the professional practice of health and social care, what are the 6 C's of health and social care which are discussed again and again when we study health and social care course. So this topic is for the module Introduction to Health and Social Care Practice for Foundation Year. The module code is SHN3143. So as I said, we are going to discuss today in detail the 6 C's in health and social care. So what do you think each of these 6 C's means? So there are 6 C's in care, in especially health and social care. So these 6 C's means there are 6 words that are derived from letter C. So the first one is care, compassion, then commitment, communication, courage, and communication. So these basically 6 C's are the set of principles that guide the delivery of high quality care, particularly in health and social care settings. They focus on providing compassionate, person-centered care that respects and supports the health of the individual and supports in their well-being as well. So today we are going to discuss one by one each of this C, each of this letter. What does it mean in health and social care? Why so much importance is given to it, and why it is being discussed again and again that we have to follow the 6 C's which are very important in health and social care setting. So the first C, so you can say the first word is care. So care basically is the core is our core business of health and social care and of the different organizations as well. It means we deliver, and the care we deliver helps the individual persons. It also improves the health of the whole community. Basically the word care means in health and social care means that the services we are providing should meet the patients with kindness, respect, and consideration. So if we take an example of how we are going to show a care in health and social care setting, for example, a nurse helps a patient feel comfortable and listens attentively to their concerns, ensuring that they receive an appropriate treatment. So this could be an example of care. So the next is compassion. Compassion is how the care is given through relationships based on empathy, respect, and dignity. It can also be described as intelligent kindness and is central to how people receive their care. So if we talk about definition of compassion in simple word, it means understanding and being sensitive to the suffering of other people and taking actions to help them. So for example, if we talk about healthcare setting or healthcare social care setting, we can take an example of doctor who notices a patient feels anxious about the procedure and takes extra time to explain it in a calm and reassuring way. So this is the way to show the compassion. Next C is competence. Competence means all those in caring role must have an ability to understand an individual's health and social needs and the expertise, clinical and technical knowledge to deliver the effective care. As it means simple words, having the necessary skills, knowledge, and abilities to perform the different tasks effectively and safely. For example, a healthcare worker ensures they are up to date on medical practices and protocols before administering medications to patients. Next is communication. Communication is central to the successful caring, and you can see it's not just about health and social care setting. In every setting, effective communication plays a key role. It means sharing information clearly, openly, and honestly with patients and their families. For example, a doctor explains the patient's conditions and treatment options in simple terms, ensuring that both patients and their families understand them, and especially the patient, and so that the patient can make the informed decisions as well. Communication is a key to good workplace with benefits for those in the care, in our care, the service users and staff as well. The next is courage. Basically, courage enables us to do the right things for the people we care for, to speak up when we have concerns, and to have personal strength and vision to innovate and to embrace the new ways of working. This, in simple terms, means standing up for what is right, even when it's difficult, and advocating for the best care for patients. For example, a nurse might speak up if they notice something that could compromise patients' safety, even it means challenging colleagues' action as well. So, in simple terms, a person should stand up when things are going wrong. They should, whistleblowing plays an important role. They should report the wrongdoings. Um, Next C is commitment. A commitment to our patients and population is the cornerstone of what we do. This, in simple terms, mean being dedicated to providing the high quality of care and ensuring the patient's well-being. For example, a caregiver might consistently follow up on patients' progress, ensuring they receive the right care and is always ready to go the extra mile to support them. So we have discussed care, compassion, commitment, competence, and courage. So these are the six C's which are very important in health and social care. These are basically six values. They help ensure that the care we are giving is holistic, patient centered, and it focuses on both physical and emotional well being of the individuals. Now, let's take an example which will help you guys in making your assignments as well. So, we will review a case study and we will see how we can use the six C's in this context, in the context of this case study. So as you can see in the case study, Mrs. Patel, an 82 years old woman with dementia, resides in care home. She often becomes disoriented, anxious and frustrated, struggling with memory loss and confusion. She sometimes forgets to eat, has difficulty recognizing staff, experiences emotional distress when separated from her family. The care team must ensure she feels safe, respected, and well cared for while addressing her physical, emotional, and psychological needs. For example, if you're given this case study and you're asked to use or explain the six C's in this context, so how you're going to do, I'm going to point out a few of the things here that will help you out in your assignment as well. So, first of all, the first C we can see here, you can check my pointer. The first C is care. So the now in Mrs. Patel case, the care teams provides a personalized and dignified care by ensuring that her needs, basic needs like nutrition, hygiene, and comfort are met. Staff should take the time to understand her preferences, provide a calm and reassuring environment to reduce anxiety. Now, the next C is, so in this way they can ensure the effective care. Now, the next C is compassion. So now in this case, staff could show kindness and empathy by acknowledging her distress and comforting her when she feels confused and scared. They may use gentle touch, soothing tones, familiar objects like family photos to reassure her. So, in this way, they can show the compassion. Now, the next comes is competence, how they are competence matters in her case. So the caring staff should be trained in dementia care and should be trained enough to use the specialized techniques such as different therapies, structured routines, nonverbal cues so that they can support her effectively. They continuously update their knowledge to should continuously update their knowledge to improve the quality of life of Mrs. Patel. So in this way, competence matters. Uh, and then next is communication. I'm so sorry, there is, yeah, communication is missing from here, from this picture, so we can discuss as well anyways. Communication, since Mrs. Patel struggles with memory and verbal expression, staff should choose the clear, simple language, visual aids, and body language to help her understand and respond. They should also communicate regularly with her family to ensure consistency in her care. So in this way, they can show the communication. Effective communication plays important role. Next, 6C, that is courage. It plays an important role as well. So how it could be implied in Mrs. Patel case. So basically, staff should advocate Mrs. Patel's need, ensuring she receives the adequate medical attention, emotional support, and an individualized care plan. If they notice any signs of neglect or inadequate resources, they should speak up to improve her care. So in this way, you can show the courage. Now, commitment is also very important when providing a care. So in this case, the caring team should remain dedicated to Mrs. Patel's well-being, ensuring her care plan is regularly reviewed and adapted as her condition progresses. And they should show up the long-term dedication to improving dementia care services in the facility. So in this way, you can describe wherever you are given a case study and you're asked to apply the 6 C's. So in this way, reviewing the case study, you can apply or you can explain the 6 C's in that context. So as we discussed, 6 C's are the 6 values which are very important when caring for service users. By applying the 6 C's, healthcare professionals, as you can see in the case study as well, they can ensure that she receives the holistic, compassionate, and high quality care that meets her physical, emotional, and psychological needs. These values help create safe, respectful, and supportive environment in which service users can maintain their dignity and well-being despite their conditions. So I hope all of you have understood what each 6C means and how we can apply them in context of a case study and can explain them. Thank you so much for listening. If you have any question, you can drop me an email. Thank you.